The perineum is continued, and we'll talk about the perineal membrane, right? So this is the perineal membrane, which is almost triangular in shape. You already know about it. Laterally attached to the periosteum of the ischiopubic rami, the apex attached to the arcuate ligament of the pubis, right? And the posterior border is free and fused to the perineal body in the middle part of it. Here, you can see this. The perineal, so the cut section of the perineal membrane. Now, very important topic question for enumeration is the structures piercing the perineal membrane. They are different in male and the female. Okay, so the urethra pierces the perineal membrane in both male and female behind the inferior border of the pubis. Artery to the bulb of the penis, duct of the bulbourethral gland, muscular branches, the deep artery of the penis, urethral artery, the posterior scrotal vessels and nerve, which are lying anterior to the transverse perineum muscle. Okay, so coming to this is a very important topic, that is the rupture of the membranous urethra. Okay, so you can see that the membranous part is the narrowest and the least dilatable part of the urethra. In case of rupture during instrumentalization, that is the placement of a catheter, and these injuries can also happen secondary to pelvic fractures. Okay, so if there is rupture of the penile part of the urethra, the parts of the urethra we'll talk further on. This can lead to extravasation of urine. Now, in superficial extravasation, the urine spreads only up till the membranous layer of the superficial fascia. As you can see, it is filling the superficial perineal space, right? This is superficial perineal, this is the perineal membrane, perineal body over here. Anterior to that, this is the superficial perineal pouch. Okay? So, this is the superficial perineal space that contains the urine in case of rupture of penile part of the urethra into the scrotum, into the penis, and the lower part of the anterior abdominal wall. However, it is prevented from going towards the ischioanal fossa or the thigh by firm attachment of the membranous layer of the superficial fascia to their boundaries. In case of deep extravasation, the urine is spreading into the extraperitoneal space of the pelvis around the bladder and the prostate and into the anterior abdominal wall. So this is your perineal membrane over here. This is the prostatic part of urethra, right? If there's a rupture over here in deep extravasation, these are the places where the urine may get extravasated. Coming to another very important topic is the urethral sphincter mechanism. You can see this is the male and the female part. This mechanism consists of intrinsic smooth muscle, intrinsic skeletal muscles. Smooth muscle in case of females and skeletal for males. Now, this urethral sphincter is anatomically different entity from the pubourethralis component of the levator ani muscle. The sphincter mechanism is surrounding more than the middle one third of the urethra. As you can see, this is the male, this is the bladder neck. We have the prostate gland. You can see the external urethral sphincter over here and the compressor urethrae muscles. In case of females, we have the vaginal wall placed anteriorly to the bladder and neck. You can again see the external urethral sphincter over here, the compressor urethrae muscle over here. In addition, we have the ureterovaginal sphincter muscle right here. So it is blending above with the smooth muscle of the bladder neck wall and below with the smooth muscle layer of the urethra and the vagina. Okay, and if there is skeletal muscle that are circularly disposed over here, it is called the rhabdosphincter, and this is basically forming the main part of the external urethral sphincter, right? So there are terminology says distal urethral mechanism or the proximal one, but this is not really it. It is just the urethral sphincter mechanism in the female. So, what are the actions of these muscles? The external urethral sphincter is compressing the urethra, as you can see, particularly when the bladder contains fluid, and it is helpful in contraction of the final drop of urine, okay, to expel it out, and it is supplied by the perineal branch of the pudendal nerve and the pelvic splanchnic nerves. Coming to another muscle, compressor urethrae. These are the muscles of the posterior or the deep perineal pouch arising from the ischiopubic rami. This is your compressor urethrae muscle over here. You can see arising from the ischiopubic rami on either side, passing anteriorly to meet the counterparts on the other side, anterior to the urethral opening. Okay. Now, sphincter urethrae is contained within the wall of the urethra over here. We have another muscle called the sphincter uretrovaginalis. As the name suggests, it is only found in the female, arising from the perineal body. The fibers are passing forward on either sides of the urethra and the vagina to meet the counterparts on the other side, anterior to the urethra, below the compressor urethrae muscle. This is the compressor urethrae muscle, it is below it and anterior to the urethra. So the action of compressor urethrae. Now the direction of these muscles, the compressor urethrae and the sphincter uretrovaginalis, suggest that they are producing elongation as well as compression of the membranous urethra and are helpful in continence in female. Both these muscles are supplied by the perineal nerve. Okay, so in case of female, the perineal membrane is pierced by the urethra, the vagina centrally behind the urethra, deep artery of clitoris, the dorsal arteries and the nerve of clitoris, artery to the bulbar vestibule, the muscular branches, the posterior labial vessels and nerves, which are lying anterior to the transverse perineum. Okay, so come to the pudendal canal, a very important topic, pudendal canal. So what is it basically? It is a fascial tunnel. You can identify this bone. This is the pelvic surface of the pelvis, the bony pelvis. You can see it is found in the lateral wall of the ischoanal fossa. You must have read before, up just above the sacrotuberous ligament, transmitting the pudendal nerve and the internal pudendal vessels. This canal extends from the lesser sciatic notch over here to the posterior border of the perineal membrane over here, right? So this is the pudendal canal, basically space between the obturator fascia and the lunate fascia. This is the lunate fascia, and others also believe there's another school of thought that it is formed by the splitting of the obturator fascia. So the contents, number one content is the pudendal nerve. In the posterior part of the canal, the pudendal nerve gives off the inferior rectal nerve and soon divides into a larger perineal nerve and a smaller dorsal nerve of the penis in case of males. Along with the internal pudendal artery, this artery gives off inferior rectal artery in the posterior part. In the anterior part, artery divides into the perineal artery, an artery of the penis, and the vein accompanies this artery. Coming to the pudendal nerve, this is the chief nerve of the perineum and of the external genitalia, accompanied by the internal pudendal vessels. The pudendal nerve is arising from the sacral plexus in the pelvis, derived from S234. Okay, so as you can see the course over here, this nerve is originating in the pelvis. Okay, enters the gluteal region via the greater sciatic notch and then leaves it via the lesser sciatic notch to enter the pudendal canal over here. in the lateral wall of the ischoanal fossae, terminates by dividing into branches. Relations. In the pelvis, the pudendal nerve descends in front of the piriformis. This is the pelvic surface of the sacrum. The piriformis is right here. Leaving the pelvis, entering into the gluteal region by passing through the lower part of the greater sciatic foramen between the piriformis and the coccygeus, medial to the internal pudendal vessels. In the gluteal region, the pudendal nerve crosses the apex of the sacrospinous ligament, sacrum and so the spine, okay, sacrospinous ligament, under the cover of the gluteus maximus. Here it lies medial to the internal pudendal vessels which cross the ischial spine. This is the ischial spine. Accompanying these vessels, the nerve leaves the gluteal region by passing through the lesser sciatic foramen and entering into the pudendal canal. In the pudendal canal, the neurovascular bundle lies in the lateral wall of the ischioanal fossa. Branches in the posterior part of the pudendal canal, like I will repeat again, we have the inferior rectal nerve, then divided into two terminal branches, the perineal nerve and the dorsal nerve of the penis or the clitoris. The inferior rectal nerve pierces the medial wall of the pudendal canal, crossing the ischioanal fossa from the lateral to the medial side, supplying the external anal sphincter, the skin around the anus, and lining of the anal canal below the pectinate line. This inferior rectal nerve we have seen and read about in the ischioanal fossa as well. So the perineal nerve is the larger terminal branch of the pudendal nerve running forward below the internal pudendal vessels, terminating into the medial and lateral posterior scrotal or the labial nerves. This is the posterior scrotal or the labial nerves in females, also giving muscular branches to the urogenital muscles and to the anterior part of the external anal sphincter and the levator ani. Nerve to bulbospongiosus also gives off to the nerve to bulb, which supplies the corpus spongiosum, penis, and the urethra. The dorsal nerve of penis or clitoris is the smaller terminal branch of the pudendal nerve, which is running forward, first in the pudendal canal above the internal pudendal vessels, then in the deep perineal space, and then in the deep perineal space between the vessels and the pubic arch. Next, it is passing through the lateral part of the oval gap between the apex of the perineal membrane and the arcuate pubic ligament, runs on the dorsum of the penis or the clitoris, and ends in the glans penis or the glans clitoridis, supplying the skin of the body of the penis or clitoris and of the glans. Okay. So, what is the clinical significance of the pudendal nerve? Basically, it is supplying the sensory branches to lower end of the vagina through the inferior rectal and the posterior labial branch. Therefore, in vaginal operations, okay, we can give a anesthesia, a pudendal nerve block. Okay, this is the ischial spine, and this is the site of the pudendal nerve block. This can be infiltrated at the ischial spine by passing a needle through the vaginal wall and then guided by a finger. Coming to the other content, that is the internal pudendal artery, which is the chief artery of the perineum and of the external genital organs, smaller in females than the males. Origin: the artery is the smaller terminal branch of the anterior division of the internal iliac artery, given off in the pelvis. You can see this is the common iliac. Common iliac divides into external iliac and the internal iliac. Okay? So this artery is the smaller terminal branch of the anterior division of the internal iliac artery, given off in the pelvis, and the larger branch is the inferior gluteal. Now, the course of the internal pudendal artery is somewhat like the pudendal nerve, enters into the gluteal region through the greater sciatic foramen, leaves it through the lesser sciatic foramen to enter into the pudendal canal over here. Relations in the pelvis running forward in front of the piriformis, the sacral plexus, and the inferior gluteal artery, leaves the pelvis by piercing the parietal pelvic fascia and passing through the greater sciatic foramen below the piriformis, thus entering into the gluteal region. In the gluteal region, the artery crosses the dorsal aspect of the tip of the ischial spine under the cover of the gluteus maximus. Here it lies between the pudendal nerve medially and the nerve to obturator internus laterally, leaves the gluteal region by passing through the lesser sciatic foramen and thus entering into the pudendal canal over here. In the pudendal canal, this artery runs downwards and forwards in the lateral wall of the ischial fossa about 4 cm above the lower margin of the ischial tuberosity, here related to the dorsal nerve above and the perineal nerve below. The artery gives off inferior rectal artery over here in the posterior part of the canal and the perineal artery in the anterior part. The internal pudendal artery continues into the deep perineal space as the artery of the penis or the clitoris. In the deep perineal space, the artery of the penis or the clitoris, which is a continuation of the internal pudendal artery, runs forward close to the side of the pubic arch, medial to the dorsal nerve of penis or of the clitoris. This artery is ending behind the arcuate pubic ligament by dividing into the deep and the dorsal arteries of the penis and the clitoris over here. Branches, we have firstly the inferior rectal artery in the pudendal canal, in the posterior end of the pudendal canal, and accompanying the nerve of the same name. The artery is supplying the skin, muscle, mucous membrane of the anal region and anastomosing with the superior and the middle rectal arteries. The perineal artery, this is here at the perineal artery, arises near the anterior end of the pudendal canal, piercing the base of the perineal membrane to reach the superficial perineal space. Here it divides into the transverse perineal and the posterior scrotal or the posterior labial branches over here. The artery of the penis or the clitoris runs in the deep perineal space and gives off artery to the bulb, urethral artery, deep and dorsal artery of the penis or the clitoris. All of these arteries are piercing the perineal membrane to reach the superficial perineal space. The artery of the bulb supplies the artery of the penis or bulb of the vestibule and the posterior part of the urethra or just only the urethra. Okay, so the urethral artery supplies the corpus spongiosum and the anterior part of the urethra. The deep artery of the penis or the clitoris traverses and supplies the crux and the corpus cavernosa, while the dorsal artery of the penis or the clitoris is supplying the skin and fascia of the body of the penis or the glans clitoridis. The internal pudendal vein, you can see the tributaries of the internal pudendal vein follow the branches of the internal pudendal artery and the vein finally drains into the internal iliac vein. So that's all about the perineum. I hope you have understood. Thank you.